As a parent, your instincts are hardwired to protect your little one, but sometimes emergencies happen, and knowing how to respond quickly can make all the difference. Infant CPR is a specialized life-saving technique designed specifically for babies under the age of 1. It's a combination of chest compressions and rescue breaths that can help circulate oxygenated blood to the brain and vital organs when a baby's breathing or heartbeat has stopped. Knowing this vital skill can equip you to handle a terrifying situation with a greater sense of preparedness and control. Equipping yourself with the knowledge of infant CPR is a powerful gift you can give yourself and your child, the gift of a fighting chance. Knowing when to administer infant CPR is just as important as knowing how to perform it. If your baby is unresponsive, meaning they are not waking up or reacting to your voice or touch, it's time to act quickly. Check for signs of breathing, such as the gentle rise and fall of their chest. If you don't see any chest movement or only see gasping breaths, it's a critical signal that your baby needs CPR. Another sign to watch for is a change in your baby's skin color. If their skin appears pale, bluish, or ashen, it indicates a lack of oxygen and requires immediate attention. The sooner you recognize the signs of cardiac arrest and begin CPR, the better the chances of survival for your little one. In an emergency, every second counts, but it's essential to approach the situation with a clear head. The first step is to check your baby's responsiveness. Gently tap their shoulder or rub the bottom of their foot and call their name in a slightly louder than normal voice. If your baby remains unresponsive, it's crucial to call for help immediately. Shout for help to attract anyone nearby who can assist. If someone else is present, instruct them to call 911 or your local emergency number while you begin administering infant CPR. Once the call for help has been made, don't delay starting CPR. Your prompt action can significantly increase your baby's chances of survival. Section 4. The beat goes on performing infant CPR. A step-by-step guide. Performing CPR on a tiny infant can feel intimidating, but remember, you are their lifeline in this critical moment. First, lay your baby on a firm, flat surface like a table or the floor. Next, place 2 fingers just below the imaginary line between your baby's nipples, in the center of their chest. Push straight down about 1.5 inches deep at a rate of 100 to 120 compressions per minute. Then, after every 30 chest compressions, give 2 gentle breaths into your baby's mouth and nose. Make sure their airway is open by tilting their head back slightly and lifting their chin. Seal your mouth over their mouth and nose, creating an airtight seal, and blow gently for about 1 second per breath. Watch for their chest to rise as you give the rescue breaths. Finally, continue cycles of 30 chest compressions, followed by 2 rescue breaths until help arrives or you notice signs of life, such as breathing or movement. Section 5. Tailoring the technique, special considerations for infants. While the fundamental principles of CPR remain consistent, there are unique considerations when administering it to infants. First, infants are prone to putting objects in their mouths, making them susceptible to choking. If you suspect choking, check their mouth for any visible obstructions. Next, due to an infant's delicate airway, even a slight overextension or flexion of the head can obstruct airflow. Ensure their head is in a neutral position, tilted back just enough to open the airway without putting pressure on their soft neck. Then, an infant's chest is significantly smaller and more fragile than an adult's. Use only 2 fingers for compressions and apply gentle yet firm pressure to avoid injuring their delicate ribs or internal organs. Knowing these specific considerations can help you deliver safer and more effective CPR, increasing the chances of a positive outcome for your baby. Section 6. After the revival, what to do when the baby starts breathing again. Witnessing your baby start breathing again after CPR can be an immensely relieving experience. However, it's crucial to remember that their condition might still be unstable. Continue monitoring them closely and be prepared to resume CPR if their breathing stops again. Once your baby regains consciousness, comfort them and keep them warm. Place them in a recovery position, lying on their side, to help maintain a clear airway. Even if your baby seems fully recovered, it's essential to seek immediate medical attention. A medical evaluation is crucial to ensure your baby's well-being. Section 7. Beyond the basics, the crucial role of formal CPR training. While this guide provides essential information on infant CPR, it's important to emphasize that nothing can replace the hands-on experience and knowledge gained from a formal CPR training course. Formal CPR training, often offered by hospitals, community centers, and organizations like the American Heart Association and the American Red Cross, provides comprehensive instruction on the latest techniques, allows you to practice on mannequins, and addresses specific scenarios you might encounter. Regularly refreshing your CPR skills is equally important. Staying up to date ensures you are equipped with the most current and effective life-saving techniques.